So doc, who are the probable patients for whom you will always advise a leadless pacemaker to go with?
So basically, I think I've told you this already, but the patients who you think have a higher chance of an infection, especially elderly age group, someone who's 85 plus or 85 plus, frail patients who you think the chance of healing is lesser, diabetics, patients who have CKD, that is chronic kidney disease, who are on dialysis, have a fistula for the use of dialysis. Those patients, if you put a venous access, it tends to get infected through the dialysis part. So patients who are on dialysis, elderly, frail, elderly age group, and as I said, on diabetes, uncontrolled diabetics, those patients, this will actually be very, very beneficial.
I'd be eager to know, after going through this procedure, particularly our leadless pacemaker, in comparison to the traditional way, is it like we can resume to our daily activities from the next day itself, and our dietary habits and everything would remain the same?
Yeah, actually, yes. You can get back to activities within a day or two, probably another day, because you've just underwent a procedure.
Okay.
Right? You'll be discharged probably the next day, and then the following day you can get back to your routine activities.
Okay.
There is no dietary restrictions. It depends on patient, but if there is no other risk factors, there's no dietary restrictions for a leadless pacemaker. We would actually encourage them to eat better, because it's always good to be healthy with the pacemaker in you. So healthy eating is always important. It's nothing to do with the pacemaker.
What about follow-ups? What about checkups and all, or coming back to the hospital again? What do you think about that?
So every pacemaker, you need to come back to the hospital for regular checkups, because you need to see how the battery life is. How is it pacing correctly? Is it got any other complications because of the pacing? All that will be checked, whether it be traditional or leadless. All pacemakers require that. So this is nothing different. You're still going to have probably once a year checkup. Another benefit is that as the leadless is in the heart, the amount of battery taken, the energy consumed is much lower. So the battery life tends to be a little longer. So the predicted battery life for the newer ones are 17 years, while a traditional pacemaker is around 10 to 12 years. So you get another 5 years of battery life too. So that is another benefit of putting a leadless pacemaker. But otherwise, I think checkup for your pacemaker is important. You'll have to hopefully come to the hospital and do regular checkups. And that, again, I think every hospital needs the infrastructure. You'll have to go to a hospital which has got the infrastructure to look for a leadless. Traditional is probably been there for quite some time, but the leadless needs a little different interrogating machine, which is there in some of the high-end hospitals. Ours being one of them, Frontier Lifeline being one of them. So we can always check for the machine. The rest of them, traditional I think is easier to check. Probably another year's time, it will catch up, and most hospitals will have that too.